Thank you very much, Mauro Zapatera or Zapaterra, for joining me in my invitation to come and chat about the human body and the spinal fluid and the brain and everything else. You have been my idol for quite a few years. And the reason that you have been my idol is because you have joined or merged together science and the spirituality. You've joined together the evidence base, because I think it's really important to have evidence based information and then weave it with a little bit of the magic of quantum physics and the world of cranial sacral therapy. So thank you. Thank you and welcome.
Thanks for inviting me. It's an honor. Yeah.
Tell me a little bit about the cerebral spinal fluid. I know that you have written papers, plenty of papers. You did your PhD on neurostem cells and the effects of the cerebral spinal fluid on an adult brain. So tell me a little bit. And obviously, we're speaking to people that don't have the scientific know-how. So let's try and explain it in a very generic way, if possible, so that we can reach all age groups and backgrounds.
Yeah, for sure. Thanks for having me. It's an honor to be on here. Beautiful talking to you already. So the cerebrospinal fluid is exactly that. It's the cerebro is the brain and the spinal is the spine. And it's a fluid. So it's a fluid that's actually bathing the brain and the spine. And many people don't even recognize that they have a fluid that's bathing the brain or the spine. Many people, when they think of body fluids, they think of blood, they think of urine, but they don't really think of the cerebrospinal fluid. So if you could imagine, right, that your entire brain and spinal cord is floating in this fluid, and it's a clear fluid. If you're healthy and you don't have any infections, it's a clear fluid. And what's amazing about it is that in the middle of your brain actually has cavities in it that are called ventricles. And these are open cavities in the middle of everybody's brain. And in those cavities, this fluid fills those cavities as well. And that some people don't know as well is that in the middle of your spinal cord, there's a canal. It's called the central canal. And it travels all the way down the spinal cord. And it's sort of like if you could imagine donut, like the middle of a donut, the central portion of that donut is filled with fluid, and it goes all the way down your spinal cord. So if you could imagine your brain and spinal cord from the inside having this fluid, and also from the outside having this fluid, and what people thought originally is that it creates a buoyancy, sort of protection for the brain. And it provides some electrolytes. It keeps the brain moist and things like that. And it definitely does provide buoyancy so that if we get into a whiplash or we get a head injury or something like that, the brain doesn't just come up and compact and hit the skull, and that there's a fluid barrier between the skull and the brain. So it definitely provides that buoyancy. And amazingly, if you think of, what it does, it's sort of like floating up and down as the waves come in the ocean, it floats up and down. And in the water, when you have something in the water, you weigh less. So, we use that principle also in rehabilitation to try to decrease weight bearing on joints. But the weight of the brain, for instance, if I was to take out somebody's brain, it'd be about 1,200 to 1,500 grams. And in the fluid itself, so what my head is actually carrying, it comes down to about 25 to 50 grams that it feels like. So there's a significant buoyancy that's happening there. And if you imagine that buoyancy, right, and we can get into this a little bit further, but you can imagine a buoy in the ocean. What a buoy does is it actually goes up and down based on the waves or the vibrations of the ocean, you could say. And so that's just kind of, you've got to think of, how is the brain reacting to vibrations or changes in the waves of the fluid, of the cerebrospinal fluid that's endogenous, that's present in all of us. So that's just number one, is that we all have this fluid. And so even just bringing your attention to this fluid and starting to recognize that it's present already starts to change your relationship with the fluid, in my opinion, and in people that I've worked with. And so the majority of people come across this fluid because, for instance, they might get a lumbar tap, or they are pregnant and they need pain relief. And so and that's actually medication going right into this fluid, and it's bathing the fluid. And so it's bathing the spinal cord, and it's bathing the nerves with the medication. And many people don't feel anything, or, it significantly decreases the pain. Some people get a lumbar tap if they're feeling sick, or, we need to diagnose things like meningitis, encephalitis, certain central nervous system degenerative diseases. And so that's when people get sort of recognize that there's this fluid. Other people might have pain and they get an epidural steroid injection if they have neck pain or back pain. And then when they go in, they have to puncture into the epidural space, and sometimes it doesn't heal, or the puncture is for whatever reason it doesn't heal, and then they have a CSF leak, and that can happen. And then oftentimes they get headaches, and they go, I didn't even know I had fluid in my brain, and now it's leaking out for me. For instance, how can you help me, for instance? So many people don't recognize that we have this fluid. What we found in the research that's been coming out is, so a lot of this started back in 2005, 2006, when really we were able to put hardcore science to this fluid, because it was really thought of just, a fluid that bathes the brain, and it provides some electrolytes and stuff like that, and it provides this buoyancy. But as mass spectrometry started coming out and being able to analyze the components of fluids and cells in more detail, you could actually get a really good sample of cerebrospinal fluid and send it for mass spectrometry analysis. And what they found is that essentially, or what we found as well, is that it's much more complex than what we previously thought, that it has a lot of growth factors in it. It's got a lot of nutrients in it. It's got extracellular matrix proteins in it, which was interesting because it's a fluid with a lot of extracellular matrix proteins and growth factors. Okay, so when you start thinking about the fluid, right, if you look at a developing brain, for instance, every single cell that makes up the brain and the spinal cord is bathed in this fluid at one point in development. So if you're, anybody listening who's interested in embryology, the way the physical body forms is quite fascinating, because in my opinion, it informs us on possibly some of the spiritual aspects of the body as well, and some of the less physical aspects of the body, how the body forms. Every single one of these cells that makes up our brain is actually connected to the fluid. So if you imagine,
when I did a course on embryology, and I found it incredible to understand and hear for the first time that our spinal fluid is actually coming from the amniotic fluid. And that just blew my mind. It was, wow, that is incredible to think that actually that's how we are formed. It's enveloped, and it develops like a sort of sea creature with a hole in the middle.
Exactly.
But I leave that one to you to explain.
No, you're right on. And even back in 2006, 2007, when I was looking at the anatomy of these embryos and starting to study the cerebrospinal fluid in detail, I was in a really large lab, and even talking to some of the people, asking, well, where does the CSF come from? And, we were starting to look at slides and embryologic development. And it was like, we had all had these anatomy classes and we had all had embryology, but asking that question never really occurred to us. And then all of a sudden it was like, wait, CSF is actually coming from the amniotic fluid. Oh, that's it, and we all kind of looked at each other like, is that possible? Is that really true? And even that, right? Even that, which isn't a discovery in of itself, it's just a fact that somebody just had to recognize, and that's what we recognize. And then, I've been talking about that since then. Is you think about how the amniotic fluid formed, and that this is a continuum from the mother's womb, right? And so in us, we have this sort of homeopathic or vestige of the amniotic fluid that's still present in us. And so energetically, the cerebrospinal fluid carries this energy of the amniotic fluid because it derives exactly from the amniotic fluid. And as the individual the embryo starts to differentiate, and just using those words is interesting. It starts to differentiate and develop and become a separate entity that organizes itself. Then the amniotic fluid differentiates and it becomes the cerebrospinal fluid. The amniotic fluid still stays, and that's the fluid that we're all floating in. And our limbs and we can touch and we drink and we, pee into it as we're developing, but it folds and it becomes then the cerebrospinal fluid. And so that fluid is essentially providing the nutrients for all the neuronal stem cells, all the stem cells of the brain and the spine in development. And the nutrients are actually coming from the cerebrospinal fluid. So that was one of our first discoveries of this fluid, was that it's very complex. It has many more proteins and growth factors than were previously thought. And it provides very important signaling cues for development, for proliferation, and a lot of the nutrients were actually coming from the cerebrospinal fluid, and a lot of the guidance of what the brain was to do was actually coming from the cerebrospinal fluid as well. So that's kind of embryologically, developmentally. And as we continue to develop and grow into adults, we still have these spaces in the middle of our brain that we call ventricles. They're still fluid. So it's quite an incredible fluid. We have close to about half a liter of it in our body at once. And the reports sort of say that it turns over 3 to 4 times per day. But the more that we actually learn about the cerebrospinal fluid, the more that we're learning that basic sort of, this is how it flows, is changing almost daily, weekly, monthly, as new research comes out. For instance, there was just research that showed that we thought that the choroid plexus, which is one of these structures in the ventricle that produces cerebrospinal fluid, actually now can absorb cerebrospinal fluids. These are new things that are coming out, and the flow of the cerebrospinal fluid, the way that we think it flows is changing. So it's just a really exciting field.
So with the movement, because obviously as a craniosacral therapist, one of the things that we're taught is actually to connect to the movement of the cerebral fluid, which is a different movement to the movement of the blood flow, for example.
Exactly.
Do you know why or how that movement is created? Is it created by the vibration of the brain? Is it created by the breath and the breath impacting the 5 diaphragms in our system? Is it because of the fascia basically contracting and letting go? What's your viewpoint on that?
Well, a lot of times it's a combination of all those. And so, to be able to differentiate what's this contribution versus that contribution versus that contribution, there are areas in the brain, like arachnoid granulations, for instance, that resorb, that pull this fluid back to the body. And so there are these areas that pull the fluid back, and then there are these areas like the choroid plexus and even part of the brain itself that make the fluid. So as you produce something and then suck it away, you're going to get a flow. That's sort of like, I'm producing something here and there's something, even if it's really far away, that's even pulling it a little bit, you're going to get some movement, right? But the more we study this, the more that we're seeing that it's just not unidimensional like this. The fluid is being resorbed by the tissues, by the nerves along the spine. The fluid is being resorbed by the spine.
So is the fluid within the nerves? So the reason why I asked that question is, sort of as a clinical massage therapist, I focus a lot on fascia. So if you have a fascial adhesion, so something that's pulling at a specific area, what tends to happen is that you'll have pain in that area, or it will reflect to somewhere else, depending on the fascial line. So if you have cerebral spinal fluid, does it actually go into the nerves, or does it stay solely in the spinal cord?
So it does go, let's say that so as the nerves come out, there's still some of that epidural space that is bathing the nerves. But then, I always find these questions really interesting, because it's sort of like, when does the tendon start and the muscle begin, right? When you actually look at that.
Yeah, that's due to the fascia.
Exactly. So now you're talking about, well, is it in? So yes, because it becomes the extracellular matrix, right? So it goes from being the fluid to being the extracellular. It's now the fluid within the cells that are creating what you would call the tissue, right? So is it important that the fluid is bathing that nerve, and that nerve has the fluid, and that fluid is then absorbed by the nerve, and it's providing moisture and we would say, let's say, lubrication and fluidity to that nerve? Absolutely. And so it's really hard to answer that question, because the answer is going to be yes, because there's never a separation. In fact, like I was just saying, we thought that the cerebrospinal fluid was just in these, what I called these hollow spaces, or these ventricles in the middle of the brain. But as research came out in the later 2010, 2013, 2014, is that researchers actually found that during certain states, including sleep, that was the first one that they found, was that during sleep, our brain tissue actually opens up, sort of has these invisible channels or caves that open up during times of sleep. And the cerebrospinal fluid actually pulsates through the brain tissue during that time period and washes the brain out. And so that was clear, because the proteins that we found in the actual fluid, a lot of them were extracellular matrix proteins. So these are proteins that are usually found in between cells, in sort of like in the liquid space in between the cells. And we were seeing it in the fluid at really high concentrations, even though there was no tissue in the fluid. And so essentially you could imagine the cerebrospinal fluid as being a liquid connective tissue, a liquid matrix. So if you see it as a liquid, right, now it makes sense that they found that this liquid then goes into the brain, because there is no separation. It is a liquid matrix. So it's going to go into the brain. It's going to go into the spinal cord. It's going to go into the nerves. And then that goes through the brain, washes out all the toxins that just build up during the day of just normal brain use. And then it goes back into the lymphatic system, and it pumps back into our heart. And so the protein, or the molecule of water, let's say, or whatever molecule you want to follow, that was in the cerebrospinal fluid at one point, now might be in your liver, going through the blood vessels of the liver, or becoming resorbed by the liver. And now, you're using the hydrogen or the oxygen molecule to do something else in the liver. So, as you see it, that's why the energetics of the fluid to me is so important, because we don't just localize it in time and space. We know physiologically that this fluid is changing. We create about 500 mils a day. It changes 3 to 4 times, but that's like what we were able to study with the instruments that we have. As more sensitive instruments come out, those numbers are going to change, I guarantee you. So we know it's changing. We know that you're producing more. We know you're resorbing more, but yet it goes into the brain, it goes into the spinal cord. And now now it becomes from your cerebrospinal fluid to the blood, from the blood to, your big toe, from your big toe back into the blood, and now back into your cerebrospinal fluid. So it's sort of like, it's sort of like this this interchangeable, very fluid system. That's the way I see it. And so if you look at it from a purely, almost like a physical perspective, right? You got the fluid, which is in the middle, and then you have the extracellular matrix that's surrounding the cells, which is sort of surrounding then the entire brain, central nervous system, spinal cord, and body. So it's just an element of going from midline, because what's fascinating is that, you have your third ventricle, you have your lateral ventricles. These are all like midline structures. Your spinal cord is midline. You have a hollow tube within the spinal cord that's sort of the midline of the midline, right? That's filled with fluid. So as you go from the center out through the tissues, then the fluid becomes more dense with the cells that it's interacting with. And so you're going from a let's say a lighter system or a less dense system to a more dense system. And so that is also interesting in terms of, even looking at going back to embryology, right? That the cells, as they develop and differentiate, they go from the center to the periphery. So they go from the center of the embryo, and then as they differentiate and become a neuron or different types of cells that need to function, which is appropriate, right? It's not good or bad. It just needs that. That's what happens. That as it goes from the center, it differentiates as it goes out to the periphery. And then if it comes back and connects with the center, then it can actually, the stem cells have been found closer to the center, connecting to the cerebrospinal fluid than the periphery. And so, just in terms of any practice that we do, connecting with our center, connecting with our midline, and then working from there, right? So there's this piece of finding your center before going out and, almost like you're finding your source energy, going into your source energy, and then you go out into the world and you touch or inject or whatever it is, but you're coming from your center. Similar thing to what the neurons do as they're developing in the brain, is they come from the center, they find their source and they go, got it. And now I have my information. Now I go out to the periphery and I can do my work. So really fascinating stuff.
It's really fascinating, especially because I know that you do a lot of meditations and things like that, which brings in the element of, sort of that sleep state or that kind of change in the brain, which basically not only brings you back to the center, but it allows the brain to be washed because of, sort of finding that meditative state. And what I found really fascinating when I trained as a craniosacral therapist was, I'm not sure how much you know about autism, but as an autistic person, I'm very high functioning autistic, but I find that my senses sometimes get incredibly overwhelmed. And while I was training, suddenly was able to become my own observer. And that's something that I have taught all my patients that come in through the door, because as soon as you become your own observer and you bring in that central line, it's kind of you gathering all your atoms and all the energy that's out there and you're bringing it into the middle of you, suddenly you're able to manage the space around you. And you can apply that whether you're in pain, you can apply that whether you're in a meeting and it's really stressful, you can apply that if you're overwhelmed, whatever situation that person may be. I find that if you can, as you say, visualize your spinal cord, and I always say to my patients, visualize the back of you, because we live our life in the front. We're always here in the front of our life, doing. Whereas if you take it to the back of your heart and the back of your spine, suddenly your energy suddenly gets centered. And it's amazing when you start applying that, how much it changes your perspective to the space that you're in. I don't know if you have found that through your meditations and your practices.
Absolutely. I feel like that's the basis of the start of a practice. And, a lot of it for me is, sort of taking our energy, which is like you said, right, which is often outward, and redirecting it in, and having a space, even an anatomical space that you're directing that, to me has been really beneficial. And so to me, it's the third ventricle, it's the midline space, it's the third eye, where there's this fluid. and then that connection all the way down my spine. So it's back and in. There's sort of an upward. I'm looking at my third as if I'm looking at my third eye, but then a direct connection down my spinal cord to my heart, and then all the way down to my sacrum.
And do you front of the body or the back of the body or in the middle?
I do it right in the, like, anatomically, right where right where the third ventricle would be.
Okay. Wow. And I know that you work a lot with chronic pain patients. You do your clinical research and regenerative medicine director at the Synovation Medical Group, and you do various programs that are quite different from the normal medical, let me give you a pill or let me give you an injection to fix your pain. What kind of thing do you do, and do you recommend somebody who is in pain and looks like they are potentially going to be in pain for quite a long time, or they have an autoimmune condition that is unable to be, go into remission?
Yeah. So I sort of see myself as the non-medication, non-like injection or surgical specialist, to be honest with you. And that's I've been doing this since about 2018. I graduated from residency in 2014, and I did I did a lot of the basic medication prescribing, injections and things like that. And those are all great when it's needed. They're fantastic. I've recommended many people to surgery, trying to understand when is appropriate to get surgery and when not. So having a comprehensive evaluation that, looks at all the medical records, looks at all the imaging, looks at, and then has a pretty extensive evaluation with each individual, because just because you have labs or imaging doesn't tell the whole story. We're not understanding your experience. And so from our perspective, it's really about trying to understand the patient individually and their experience and what they want to try to do or get back to. And just from my own work, for instance, ever since I was a kid, in essence, I've had chronic back pain. I injured myself a few times repetitively. And I've always actually dealt with chronic pain. And there are times where, like, I tell people, for instance, that, to go use the restroom, I had to essentially crawl on the floor, and I couldn't get up to pee. I had to pee sideways, or, I even contemplated wearing diapers, for instance, because I couldn't move. And so I've been in really, really, really severe, debilitating pain. And always had a philosophy of well, if it's an emergency and I need surgery, then, that's what it is. But what are the things that I can do for my own sort of self-empowerment of trying to decrease the pain that I'm having in my body, right? And so it came from a lot of self-work. It came from a lot of reading books and meditation. And it was, I just kind of started putting it together for myself. And it just happened that this specialty that my wife helped me choose, that she sort of found for me, she's like, "Hey, I think you would like this," which is quite amazing, is actually conducive towards this line of work, to be honest with you. And so we have programs, just like what you said, that are multidisciplinary. So I work with physical therapists, psychologists, and we work with patients in terms of teaching them about chronic pain, about what pain is, about the difference between pain and nociception. That many people feel that we're reacting to nociception. Pain is an experience. Nociception is essentially the signal, the sensory signal that's coming from the organ or the body part that's sending a signal to the brain. That might be a mechanical signal or a vibration or a stress signal. Stress, I mean sheer stress, but there's some signal that's coming from that periphery, and then it goes to the spinal cord and it goes up the brain, and it needs to be processed by the brain. If I inject lidocaine into you, for instance, and the signal doesn't get into the spinal cord, just like if you go to the dentist, I can do anything I want to your body, and you're actually not going to feel that pain. So we're going to change your experience just based on giving lidocaine, because the signal is not getting to the spinal cord, which is not getting to the brain. So you don't have the experience of pain. So the way that I see it is that what we are doing is we are actually treating an experience. And that's really important. right? I'm not treating your sensor. I'm not, look, you have knee osteoarthritis, you have a knee replacement, you've had it replaced, you've had a revision, you're still having pain. Okay. We can try doing, and we're well versed in sort of all the, in the geniculate nerve blocks and all these sorts of things. We can try everything, but what we have been focusing on as a world, I think 99% of us have been looking at that sensory input. So focusing on the sensory input. So we want to give you topical medications, ice, heat, TENS units, inject the nerve, stop that sensory input. Even a spinal cord stimulator is stopping the sensory input. But when you think of this holistically, there's other inputs as well that when it's chronic pain is actually probably more affecting the pain experience than the sensory input. And those are our emotions and our thoughts. And so when we have to look at this as like a trident, as like a three-pronged fork going in. We have the sensory experience, or we have the sensory input, we have the emotional input, we have the cognitive input that's coming in. And that goes in, and that gets actually processed by the spinal cord first. Then it comes up the spinal cord and it gets processed by the brain. Then the brain, in however the brain is connected, because it's not just one area, right? When they see people who are in chronic pain, it's affecting over 44 areas in the brain, right? So it's not a unidimensional. It's not, oh, it's just going to my somatosensory cortex, which is the area that can tell that, it's a sharp pinprick on my thumb. This is going to 44 different areas, including like the anterior cingulate cortex, the amygdala, the hippocampus. These are all things that are responsible for emotional processing, memory, integrating prior experiences, et cetera, et cetera. So this is a global brain phenomenon, right? So when you have chronic pain, your whole brain is essentially activated. You're creating memories based on prior experiences, your emotions, your thoughts. And a lot of times the emotions and thoughts are modulating or changing the pain experience. If you have a stressful event, if you wake up in the morning, you did absolutely nothing and you have chronic pain, but you wake up in the morning, you read a stressful email, I can almost guarantee you that about 95% of patients are going to have more pain in that body part because of the stress, because of activating the sympathetic nervous system, that fight or flight response, right? But we don't see it that way. We sort of see, oh, for some reason, my pain, we don't look at the stress actually causing increased pain. So what do? I go and I take a medication because I'm in more pain, as opposed to looking at the stress that actually caused it and doing exercises that decrease the stress, right? So we try to educate people on the three prongs going into the brain. All right. So it's the sensory, the cognitive or thoughts, and then the emotions, and then the brain itself. The brain is like the hardware. We know how the computer works, but yet the connections that are made in the brain through your entire life, that's the software. All right. And the question is,
the analogy, but yeah.
Okay. All right. So the brain, the tissue is the hardware, but our connections, how we were raised, our nurture could be genetic as well. That's the software. Okay. And so if the software is programmed to interpret these signals a certain way, then the software is going to spit out an output. That output then is going to be your experience. So if I want to, since we're treating an experience, what I want to do is I'm looking at the output, right? So I want to find out, hey, what's your output? What's your experience? Because you're coming into me because you don't like your experience. Okay. Regardless of, I know some people who, they have pain in their ankle. They're like, oh, it's no big deal. I keep on doing the things. I know there's nothing to do about it. Their experience is, they're okay. They're not coming in to see me, right? But the people who are coming in to see me, they're not happy. Their experience, regardless of what's happening, is not good for them. And so therefore they want to change their experience, right? So we have to look at, well, what are the three prongs that are going in? Because can you just get is it as simple as, what, you actually do need a surgery, and we can get that, and that's going to take care of that sensory component, and we're good, done, then that takes care of that. But being able to evaluate that is key. And a lot of times we don't evaluate all three. We just evaluate one. We keep on doing surgeries and injections and surgeries and injections and medications. And we're just sort of hitting on the sensory one without actually looking at the emotional or cognitive one. When in fact, if we looked at all three of them together, we would actually be looking at ways of changing the inputs on all three realms, right? Now there's the input, but then I talked about the software, right? And so can we then, right, what else can we do? Because the hardware is the hardware. The hardware is the brain, right? Okay, so we know how the brain works. If you get a repetitive signal to the brain, that repetitive signal is probably going to increase to some way and you're going to remember it. If I decrease a repetitive signal, I might lose it. I might lose that function and it's gone, right? If I take a newborn child who has two working eyes and I put a patch over one of the eyes and I leave that patch on for 4 years, the stimulus from that eye disappears and we've just created a blind, at least over that patch, cyclops, let's say. All right. So if you don't get the stimulus, you're not going to create the neuronal pathways to actually have that function, right? When you're in chronic pain, the chronic pain is the repetitive stimulus, right? So you get this repetitive stimulus that's constantly coming from that pain area. Now that's going to the brain. And if we're not doing anything, well, we can give medications and injections and we're trying to decrease it. But if we're not doing anything consciously, we're not recognizing that the stimulus is actually starting to form a memory because it's a repetitive stimulus, just like anything that you'd want to learn in the brain. And then all of a sudden the brain is actually learning pain, right? So we want to undo that. We know how the hardware works. Repetition is going to create stronger connections. But if we change the repetition, if we can actually learn how to change the repetition, yes. Can medications change the medication? Absolutely. Can surgery? Absolutely. Injection? Absolutely. But when we're in chronic pain, sometimes we've tried all that. And so we need to do other things as well. And that looks at cognitive inputs and emotional inputs, but it also looks at the software. How's your software? And everybody is focusing on the inputs, but not really looking at the software. We also have to look at the software, right? What are the practices that we can do, that we have to do on a daily basis that starts to reorganize that software, that takes version 1.2 and makes it into version 1.3? So that, right, if I upgrade the software, now the input comes in and maybe my software can actually process the input differently to give me a new experience. Right? Does that make sense? Because it's very multifactorial. It's looking at the inputs, but it's also looking at the software, which is essentially the mind. It's essentially the matrix of the mind and how our connections between areas of the brain have been created over time from birth, right? So we've got to look all the way back to birth and say, well, how is your amygdala connected to your hippocampus? And what sort of connections do you have? And what pathways? What are the strong pathways in you? Because if you've had experiences in the past where, for instance, you've had pain and it really didn't heal, well, guess what? That's a pathway that's a pathway that's set in the neuronal connections in the brain. Right now, if you get another injury, the same pathway is going to trigger. So if you're programmed in your brain to have that pathway triggered, then it's likely then that's sort of where you could almost like predict the future. It's sort of like, well, I'm going down this path again, right? And so we want to be very, very conscious, and that's where we do a lot of patient education, a lot of time educating patients on these mechanisms and what are the things that can be done on a daily basis to not only try to change the inputs, but also to start working on the software, right? And these aren't things that happen immediately with patients who are chronic pains. We say, look, 6 to 12 months, 12 to 24 months, right? If you've been living with something for 30 years, it's going to take a longer time than if you're living something with, for 6 months, for instance. With young people, with like 20s, people who are in their 20s and 30s that we see, we come down really hard because they see it. It's sort of like they're triggering, right? They're creating those pathways. That's when we want to come down the hardest to really kind of shift the way that their matrix, the way that their software is being formed, we want to shift that hard and really not allow those pathways to be created, the memory pathways of the chronic pain and the fear and the and fear of moving and avoidance activities and stuff like that, because that's more than likely not what's going to happen. So,
Just out of my own interest, when you are dealing with younger people, how do you change that so quickly, considering, let's say you have a teen that's dealing with whatever anxiety, how do you manage them and the parent? Or are you dealing with predominantly 20-something-year-olds? Because
no, for younger people, yeah, the parent actually, but the parent wants the child to heal. And they're actually, many are happy when we come down, but it's more, I'm not saying like we come down like with a, like we're more forceful in the language that we use, that this is imminently important for them right now to make these changes, and we cannot be lazy about it. We have to do the exercises. You have to do them daily. Where somebody who's in their 70s or 80s, for instance, that's been living with it for 30 years, it's more, okay, look, I'm like, wow, congratulations for surviving, right? Congratulations for making it this far. Like I can't imagine being in that, a motor vehicle accident and coming out and having 14 surgeries, and like, great job, right? You're nervous, like your system, amazing that it's functioning as it is, so starting from there and then going, okay, now, right, you came to see me, now how is it that we want to shift direction? Well, this is happening, or this is happening, or when I see my children, I'm not able to be as active with them, or even as, when I see my children, it's sort of like these thoughts come up and I start having, I start going into possibly like some PTSD or something like that, or regret. It's so great. Okay. So are you willing to work with us? Because this is probably going to take about 2 to 5 years. Right.
It's very hard understanding for a lot of people in chronic pain or with, sort of autoimmune conditions, that actually the buck stops with them, in the sense that it's not a question. Yes, you can try and go for the pill. Yes, you can go for the injection. You can go for the operation. But the likelihood is you're still going to be in pain, or you'll have a window of 6 months and then it'll come back. And it's down to you to take responsibility and make the change. And the
Exactly.
might not be completely gone, but it's, looking at your diet, looking at your mindset, looking at your movement, looking at your breath, looking at, sort of all the different layers of the human body need to be addressed. As you say, when you talk about the pathway, I see, kind of the road runner. If he runs one time, you only get a few footprints. But if he's backwards and forwards, he's going to dig a hole. There's going to be a trench, and
absolutely
big trench to fill. Whereas if you're starting from afresh and you only have, a couple of footprints, that's easier to resolve.
Yes. I have a really good friend of mine. He's a professor of law and sociology at the University of Minnesota. And it's amazing, somebody would say, well, you do pain management. He does law and sociology. There's no overlap there. But yeah, he's looking at social patterns. And one of the social patterns he looks at is changes in communities and things like that, and how those changes starts. And he actually had a time-lapse video, exactly what you said. He actually had a time-lapse video of there was a patch of grass with like flowers and stuff like that in a university, and the trail that was paved already went around this patch of grass, but the way that the buildings were situated, it made more sense to just go right through it, like diagonal. But the way that they wanted to sort of see it from above was almost like these rectangular sort of pathways that people walk down to get to the next building. And they had I believe it was like a CCTV camera that was just watching this path of grass for, 2 years or something like that. And they saw exactly what you were, that one person, they just said, this is just taking too long. I'm going to go through it. And one person did it and you didn't see any change. And then the next day or 2 days later, another person did it, and you really didn't see any. And then slowly, that path of grass was stamped down, you know? And then it took like 2 years or something like that, but then the university came along and paved through it. And that's exactly it, right? So consciously, right, what are the tracks that you're laying? And this is a really important to understand. But where we direct our attention, what we're paying attention to, where our awareness is going, what practices we have. These are even the subtle movements of our attention away from something that we're focusing or concentrating on. Even that is a little trigger. Okay, I'm going over here, right? It's like, no, you're off the track. Come back, right? And even recognizing that, not slapping ourselves on the face and going, oh, I suck, I totally am bad at this, which happens to everybody, but recognizing that that's just part of the process. So yes, you're going to fall off the path, and now you just come back in and you do that with love and kindness and compassion and for yourself. And you're just like, here I am again. Here I am again.
No, it's lovely. I'm so enjoying this conversation because it so resonates with my belief and how I work and how I view life. Because I was a personal trainer in my former life. I've had quite a few paths, but they're all related to the human body. And when I was a personal trainer, I used to have patients or clients at the time that would say, I'm going to come to you four times a week. And I'll go, no, you're not going to come to me 4 times a week. You're going to come to me, I'm talking about obese people. And I say, you're going to come to me twice a week, potentially once a week. And I'm going to give you homework, and you're going to do that homework once a week, even though you're going to leave here saying you're going to do it 5 times a week. Because the reality is that you need to manage your expectation. And you need to say to yourself, okay, I'm going to do baby steps, even though my goal is to do 5 times a week. If I do baby steps, then I'm going to be kind to myself. If I'm going to say to myself, I'm going to do 5 times a week, you're setting yourself up to fail. And if you're going to fail, then that beautiful negative little voice that we have in our head is going to say, you see, you're useless, you're rubbish. Why did you do this? Da, 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 da. And then what happens then? You cause loads of chemical reactions that are not particularly nice for your body, and they get lodged into the areas that shouldn't be lodged, and then you start getting pain. And that's one of the things that I say to a lot of my patients is I give homework when they finish with my treatment. And I always say, please do the homework in a kind fashion. If you're too stressed, don't worry about it. Do it another day. Just be aware that you're really stressed. And when it comes to pain, be aware of your body. Know how your body feels. Be inside your system. Because we're so much in our head, and it's interesting we're talking about neurology and the brain. But if we're just in here, if we're just in our head, we disconnect from the pathways. And if we're disconnected from the pathways, then we don't realize the pain that's starting to come. And we're ignoring it, and then it starts getting worse and louder and louder and louder. And that's when they start trying to find a solution. But by then, the little roadrunner has run quite a few times, and it's harder to assess, if you know what I mean.
Exactly.
Yeah. Well, amazing. And I know that we're reaching our end, but it's really amazing to discuss this, because I think it's really important for people to be aware that every emotion and every movement and everything that you see, think, feel, eat, drink has a chemical reaction in your system. And that chemical reaction is then connecting to your brain and giving a result. And every time that you're having a result, it could be a negative result or it could be a positive result. And if you're not aware and you're just feeling negative results, then the system's going to be really struggling by the end. I don't know if you agree with that.
Absolutely. Yeah, there's a classical, I guess, adage, which is essentially, where attention goes, energy flows. And so we need to pay attention, and even using this in kids, for instance, like, where's your attention going? Because that's where your energy is flowing. And where do you want your energy to flow? And yes, it's okay to recognize where my energy is flowing, but then what can I do where do I want to shift it to, right? And giving people tools to even be able to shift, whatever that might be. Maybe it's a mantra, listening to music, having something else to focus on, as hard as it might be, emotionally, cognitively, in terms of thought, but also you just mentioned, sensation, your whole body, right? What am I noticing in my whole body? And what is that the sensation that I want to pay attention to? Is that the sensation that I want to be predominant in my awareness right now? What other sensation is there in my body? Can I find another one that's more resourcing? Can I find another one? Can I actually go look for a sensation in my body? It might be the connection of my feet with the floor. If I need to take off my shoes and go out into nature and feel the grass, or put my feet in the sand, and that's the sensation, but I'm driving it, right? There's a conscious driven aspect of it, as opposed to just whatever is happening being driven. And that's where the attention is going, and that's where the energy is flowing. And trust me, I've been there. Not good. I've been there. I know the deep ruts that we can all get into. And yet, even when we're in our deep ruts that we think that nothing could work and I'm just wasting my time, that's the exact moment to say, try one more time, try it again. I'm going to try it again. I'm going to try it again. And we slowly take ourselves out of it, and we continue that practice. And over time, sort of like a quantum shift, right? Your electron is vibrating, and you don't see a change in the structure of the atom, or you don't see the change in the molecule, but then all of a sudden you get a quantum leap in that electron, and boom, you have a completely different element. And that actually happens with us as well. So you're doing the practice and nothing seems like it's changing, but even on a quantum level, energetically, there's a shift that's happening. We might not see it, maybe we sense it, we might not sense it. For somebody who's more sensitive, maybe they do sensitive, God bless. But then all of a sudden it shifts, and then it's sort of like a new element forms, and you sort of are like, wow, I would have never imagined that would have happened, but it did. But yet I got to keep that energy going, right? I can't stop. And that's important as well, because a lot of people, when they start feeling better, they go, oh, I'm feeling a little bit better. Okay, I can stop, right? And we can't, if you're noticing the improvement, and I even say, look, after 4 weeks, if you notice 1% improvement, just even the smidgen of some improvement, that's when you continue going. So, yep, absolutely. The senses in the body, feeling the connection, feeling the mind, heart, body connection. And even if you are in meditation, there might be an altered sense of the periphery of your body, of where your body ends and begins, and sort of even connecting your energies to the universe and to the world around you. Whatever source energy may be for you, and having a relationship not only with the micro, the physical, I'm touching my fingers here, but also with the macro, with the undifferentiated aspects of our energy field, and that comes later.
I'm aware that you do the Awakening Awareness program, and I hope you don't mind me mentioning it, because it'd be great if people were to follow you. I'm going to put it on the podcast script, so that they can follow the program. But it's a really positive and wonderful program from what I've seen. I know that we're way over time, but if you don't mind just giving a very small snippet as to what the program is, so if people wanted to attend or join, that would be really helpful for them.
Yeah, it's actually free on YouTube. It's a recording that we did with the Emerging Sciences Foundation. And essentially it was sort of like, hey, we're interested in these meditations that you do around the cerebrospinal fluid. And, can you guide us through a meditation on the cerebrospinal fluid? And I said, well, before we go there, we got to go back. We're not going to go through a meditation on the cerebrospinal fluid. And so essentially it's a 24 sessions, and it's not meant to be, one a day. It's really at your own pace. You don't progress until you feel comfortable with the step that you're at. And there's a lecture part to it, and then there's a practice part to it. And essentially it just sort of, it's sort of like an introductory course to to mindfulness and meditation, if you were to say, with being able to just be present with yourself, with regardless of what thoughts or emotions or sensations arise. And so it really starts out with, and this is sort of my recommendation, it really starts out with finding a resource for you, a place that you can direct your attention to that feels safer, that you can come back to over and over and over again, and find a resource. And it might take you years to find a resource before you can actually move on. But for, depending on what your past life experience is, finding a resource may be a very challenging thing. And so we sort of spend some time in terms of trying to define resources, what those are, and then go through that in terms of finding a resource, learning how to titrate unpleasant sensations and pendulate from an unpleasant sensation to your resource, et cetera, et cetera. And then it goes on to the senses, the thoughts, the emotions, sort of a classic mindfulness, but then goes more into interoception, being able to feel what it feels like to be, your bone, for instance, in your hand, and it sort of takes you through a meditation of that. Or, we're always perceiving from the outside in, but how would it perceive from the inside out? So almost as if you're placing your attention on the inside of your hand, and now you're feeling the sensation of, the air making contact, or the blood vessels, or the nerve, becoming the nerve. And then more subtle senses within the body. So it really goes deeply in that. There's a part on anatomy and embryology, because I do feel, and this is sort of my cerebrospinal fluid work, but like when I started learning about the cerebrospinal fluid, I had a very good sense of anatomy, and the anatomy allowed me to investigate. By knowing the anatomy in detail, it allowed me to investigate the subtle felt senses that were occurring in the body. And it was sort of like I was my own investigator, and I was asking myself like, oh, where is that? And even just if you pose the question like, oh, is that my, X, is that my breathing, or is that my heart rate, or is that my, and having the knowledge of what are the different layers of the anatomy, or what are the different parts of the anatomy in that body part, allowed me to be able to localize and actually understand the energies better. And so anatomy and embryology are really important. So there's a couple lectures on that, and then some meditations on that. And then it finally gets into the cerebrospinal fluid, sort of a view of the cerebrospinal fluid, what it does scientifically, and then what it can do, what some of the hypotheses are in terms of esoteric and sort of spiritual views of the cerebrospinal fluid. And so it takes one through that entire process.
Beautiful. Beautiful. Well, look, I'm going to do the whole program, and I will definitely be promoting that on the website as well, so that people can find out about, all of these different layers. It's one of the goals that I have, is to educate people about their layers so that they can support themselves, empower themselves, and help themselves to heal. So thank you so much. It was an absolute pleasure to speak to you, Mauro. Really, really amazing. I could chat for another.
It was a pleasure speaking with you too.